Well, we are joined this morning by Dr. Priya Vicaria, who is raising awareness about geographic atrophy and also telling us about a treatment for it. So thanks so much for joining us this morning.
Thank you so much for having me.
Yeah, of course, of course.
Dr. Vicaria, what is geographic atrophy and what are some signs that individuals may have it?
So geographic atrophy is a form of advanced dry macular degeneration. It is where patients who have dry macular degeneration can get areas of the retina that stop working, almost like a bald spot in your backyard, an area where the grass stops growing and can get larger over time. Same thing with the retina, an area where the retina stops working and can get larger over time and can lead to vision loss. Symptoms include, decreased reading, decreased with just activities of daily functioning, but also things like distortions in your vision or difficulty contrasting colors or light and dark. Those are all symptoms of early geographic atrophy.
Okay, interesting. And are there any notable factors that might tip somebody off that they may have this?
One of the biggest risk factors is, family history. That's one of the biggest things. So if you have a family member who has macular degeneration and or needs injections, that's one of the things that is the biggest risk factor for developing geographic atrophy. Other things include age. And like we talked about, if you're out there and you're having some vision problems and you have dry macular degeneration, it may be a sign of early geographic atrophy.
Okay, interesting.
And what about a treatment for it? How does it work and how has it been shown to help with adults?
So we have our first treatments for geographic atrophy, which is huge because before last year, we didn't have any treatments for this. And so now we do have FDA-approved therapies. I'm here on behalf of Astellas to highlight Izervay, which is an intravitreal injection, meaning an injection given into the eye every month to help slow the progression of geographic atrophy. And studies have shown that it slows progression by anywhere from 18 to 35% after 1 year. Certainly there are risks to everything, risks of medications, and the risks of this medication include an increased risk of wet macular degeneration and a transient elevation in intraocular pressure. And of course, as with all injections in the eye, there's a risk of infection and retinal detachment. And so again, important to talk to your retina specialist about these medications, but again, represent the first time we have had treatments for geographic atrophy, which is pretty remarkable.
Yeah, that's awesome that they do for the first time have a treatment for this. And as someone kind of specializing in the eyes, what kind of advice do you have for patients who are living with geographic atrophy?
I think the best piece of advice I have is to talk to your doctor, talk to your retina specialist, and see if you're a candidate for therapy. Don't think that just because you're getting older, you're just losing vision, and that's normal. You may have a condition or you may have vision loss because of geographic atrophy. And the other thing is, if you have family members, make sure they're getting their annual eye exams with their eye care specialist just to screen for any eye-related conditions.
Okay, awesome. I'm really glad to know about this, and hopefully viewers, this will kind of help you guys out. And thank you so much for coming on and raising awareness about this and letting us know all about it. Thanks for joining us.
Thank you for having me.
All right, thank you. All right, stick around, guys. We'll be right back.